Are you wondering how GLP-1 medications can help individuals with PCOS on a weight loss journey? Hi, I'm Dr. Allie, an obesity medicine physician, and I want to talk just a little bit today about PCOS, weight loss, GLP-1s. Okay, so individuals with PCOS, for the most part, we know that there's going to be some degree of insulin resistance. Okay, even if the labs are normal, if there's a history and diagnosed PCOS situation, we can pretty much determine that there's going to be some insulin resistance. Okay, so GLP-1s, how do they work? Well, they delay gastric emptying. So if food is leaving slower from your stomach, you're gonna have less of a glucose response. Therefore, you're gonna need less insulin to take care of that glucose. So it really helps with glucose control in that way. The next thing is that GLP-1s actually help us release insulin effectively. This means that the insulin we are releasing is going to work, therefore we're not gonna have to release excess insulin. Remember, insulin is a fat storage hormone. Okay, third way, GLP-1s actually help our liver to not release excess glucose into the bloodstream. Okay, so overall, GLP-1s are really helping with that glucose control. When we have help with glucose control, we improve our insulin resistance. Okay, so with all this being said, the other thing that PCOS patients struggle with are hunger hormones, leptin and ghrelin. Actually, the signaling for the hunger hormones is actually sometimes abnormal. So what this means is it's more difficult having satiety, number one. And the next piece is that when somebody has, for say, leptin resistance. And I will tell you, with PCOS individuals, if they've been overweight most of their life, most likely they've been on these cyclical diets, losing and gaining and losing and gaining. And what happens here is that our leptin becomes resistant, which means it says to your body, don't release body fat. Okay, so GLP-1s actually help reverse leptin resistance. Okay, so there's all these different ways that the GLP-1s can help individuals with PCOS. Now, here's the deal. If there's somebody with PCOS and they're borderline meeting the criteria for the medication and their labs are, not terrible, it doesn't mean they don't have insulin resistance, and it doesn't mean that they can't benefit from a GLP-1 agonist. So this is where we really have to catch up and be able to think outside the box. So what I'd say is this: if this is you, look for a provider that's willing to look outside the box on what you're dealing with and what you're struggling with. They're out there. We have some great docs in our field. And actually on April 19th and April 30th, I'm doing live webinars. They're free. And I'm going to be talking about weight loss on GLP-1 agonists. You can go to my profile and click, and you can sign in for these webinars. I'm really excited to meet with you. And again, I'm going to keep sharing information, and I hope that this is helpful for you. All right, my friends, have a great day. We'll talk soon.